people are now more and more seeking preventive healthcare as opposed to what they did prior to 2020, prior to COVID.
Yeah, you're absolutely right. I think I'll just take a step back and basically because we are talking about the healthcare getting expensive, the first thing we have to understand, it's a supply and demand gap also, right? We are talking about 1,100 beds for one patient, 1,100 patients for one bed, 1,100 doctors for one patient. We're talking about a huge gap, and whichever country has tried to make it more accessible or are driven by insurance or by government, I think all of them are struggling. We have NHS as one example. We see American healthcare failing. You cannot give healthcare for free. That's very, very clear because the country cannot afford that. We're talking about 100 million diabetic patients by 2035 in India, and just that cannot be affordable. So I think we have to also understand the only way to protect that or to actually deal with that is preventive. How can you actually, like he rightly said, how can you actually detect the disease much earlier? We've seen the trend change. COVID has changed a lot of stuff. I would probably say just in the last 1 year, we have seen a 23% increase in people taking a preventive test in just the January month this year, right? And I always see January because the new year comes and people take new resolutions, right? So just that 23% increase. And if you look at awareness definitely is all-time high. Specifically, all of us sitting here, probably you just tell them they will order a black coffee or a green tea, but they will not go for a normal sugar tea. And that's the kind of an awareness change that is happening. So people are getting aware, they're counting their steps, they're doing something about the health. The awareness is there.
But not getting the checkups.
Yeah, but the checkup is the thing which is not happening still, right? It could be a fear of getting a needle in, it could be a fear of anything, or the largest fear that I have seen in my service is fear of getting detected. And that is the largest fear people have. They don't want to get detected. They don't want to change their lifestyle after getting detected. So you smoke as many cigarettes you want, but you won't check because you don't want to stop smoking. So that's the issue.